Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video we're going to be talking about ectopic pregnancies. Ectopic pregnancies. So ectopic pregnancies are also known as extrauterine pregnancies. Extrauterine pregnancy. And this basically just means that it's a pregnancy outside of the uterus. Outside uterus. And so when the egg is released from the ovary, it usually travels down the fallopian tube and into the uterus, where it's either fertilized in the tube and implants in the uterus, or is even maybe fertilized inside of the uterus. But in ectopic pregnancy, usually the egg gets stuck fertilized inside of the fallopian tube. And then it will implant and start growing inside of the tube. So usually an ectopic pregnancy is what's known as a tubal pregnancy, where the baby develops inside of the fallopian tube. So this is a tubal pregnancy. But ectopic pregnancies can also be from an egg fertilizing and implanting inside of the abdomen, or even inside of the cervix. It can even go kind of past the uterus and inside of the cervix and start implanting and growing there. These are extremely rare. 90% of ectopic pregnancies happen inside of the tube. So these are 90% of ectopic pregnancies, and ectopic pregnancies are already extremely rare. About 2% of all pregnancies are ectopic, or 2 in every 100 pregnancies. And to be clear, these pregnancies are non-viable. Non-viable. So the baby will not survive an ectopic pregnancy. The baby cannot grow inside the tube. It can't grow inside the abdomen. The baby will not survive. It has to be dealt with some other way. So the goal with dealing with ectopic pregnancies is to keep the mother alive. Okay, so what is the mechanism of ectopic pregnancies? So usually the egg is getting stuck inside of the tube for a reason. One of the most common reasons is scarring of the tube. So you can actually have scar tissue that builds up inside of the fallopian tubes, and this prevents the egg from actually traveling down the tube into the uterus. So scarring, and so this can actually be caused by a few different things. It can be from STIs, so chlamydia is a common one that causes scarring of the fallopian tubes. You can also have previous surgeries that may cause scarring of the tubes as well. And all of these that cause scarring inside the tube may cause challenges for the egg to get through the tubes into the uterus. Another common cause is IUDs. So IUDs are highly effective contraception. We talked about IUDs in the hormonal contraception videos. They're very good at preventing pregnancy. But if a patient has an IUD and has gotten pregnant, almost all of the pregnancies while having an IUD will be a tubal pregnancy. And that's because the IUD stops any sort of pregnancy from occurring inside of the uterus. And so if there is a pregnancy, it will likely be outside of the uterus. Another rare instance is tubal ligation. Tubal ligation, and I don't believe we've talked about tubal ligation before, but this is a sterilization technique. Sterilization. So sterilization is to stop someone from ever getting pregnant. This is permanent contraception, if you will. And so an OBGYN will actually tie off or cut the fallopian tubes on both sides. But if there's a mistake, or if it's not completely blind end, then the egg can sometimes get stuck in the tube, but sperm can still get across, and you get a pregnancy inside of the tube. So again, if a client or a patient has had a tubal ligation but is now pregnant, you would definitely want to make sure that it's not an ectopic pregnancy. And then the last option, which is always the case in medicine, is spontaneous or idiopathic ectopic pregnancy. Basically, we don't know. Sometimes the egg will just settle inside the tube. Some people genetically have narrower tubes that are more likely to cause ectopic pregnancies. So maybe genetic. Maybe other causes as well. Some people just get ectopic pregnancies, and there's nothing really that can be done or even known in advance to stop it. Okay, so this is what ectopic pregnancies are and why they happen. What are the symptoms of ectopic pregnancy? Right. So one of the first symptoms is that the patient is pregnant. So they will have signs of pregnancy, so maybe a positive pregnancy test. They may have missed a period. They would have other signs of being pregnant, like maybe tender breasts, morning sickness, nausea, vomiting. So all of the signs of early signs of being pregnant, they would have because they are pregnant. The body thinks they're pregnant. It's technically a pregnancy. It's just in the wrong spot. The more severe symptoms that aren't associated with pregnancy would be abdominal pain, and there isn't a specific area of the abdomen that would necessarily be in pain because it depends on where the ectopic pregnancy is happening. Usually for tubal pregnancies, it'll be kind of lower quadrant, right where the tube would be. But you could also have abdominal pregnancies that causes abdominal pain quite a bit higher or lower. So it really depends on where the ectopic pregnancy is happening, is where you'll have the abdominal pain. You'll also usually have vaginal bleeding. So abdominal pain and vaginal bleeding are really the early signs and most common signs associated with ectopic and tubal pregnancies. So we'll come back to symptoms in a second, but we'll talk about diagnosis of kind of early ectopic pregnancy, so before it becomes an emergency. So diagnosis, you may imagine, is ultrasound. So if someone comes in and they have signs of being pregnant, but they have some abdominal pain and vaginal bleeding, they may get an ultrasound, and basically we're looking for a baby inside of the uterus. And so if there's no baby inside of the uterus, there's a very high chance that it's an ectopic pregnancy. So if you can't see any sort of baby or even gestating sac, it's called, then there's a high chance it's ectopic. So no baby in uterus. And again, this is assuming they are pregnant. So if they are positive for pregnancy, but there is no baby in the uterus, that's ectopic. Of course, if they come in and they don't have signs of being pregnant, they have abdominal pain and vaginal bleeding, and they have an ultrasound and there's no baby, then it may not be ectopic pregnancy. It could be some other issue. So the last thing that I wanted to talk about are the real warning signs, the really bad signs that you've actually ruptured a tube. So when these tubal pregnancies begin to grow, the baby will continue to grow inside of the fallopian tube and cause it to expand until it ruptures. So this tube will eventually rupture as the baby grows and grows. So ideally you want to catch it kind of in these early symptoms before it gets bad enough that the tube ruptures, because when that happens, then it's life-threatening to the mom. And so really this tubal ligation causes severe internal bleeding, and so really you're looking for signs of hypovolemic shock. Signs of hypovolemic shock. And hypovolemic means hypo is low, so low, we've talked about hypothyroidism as being kind of low thyroid hormone. Hypovolemic is low volume. So volemic is specifically talking about volume of blood. Volume of blood. So your body goes into shock because it's lost too much blood. And so we'll talk about more about this in postpartum hemorrhage, but you'd have signs like rapid breathing, lightheadedness, maybe even confusion. You may go pale as well. So these are all really red flag signs of a ruptured tube. Ruptured tube. And if anyone comes in with these signs, of course, this is an absolute emergency. This patient would have to go to the operating room to have surgery done to repair this ruptured tube. And they may just lose the tube. They may use the whole uterus, depending on how bad it is and what other symptoms they have or what other problems that they have going on. But again, ideally, you would see these symptoms earlier and prevent it from getting to the point of a ruptured tube.